Hey there, Dr. Audrey Tai here, and today we're diving into a topic that is important for anyone considering cataract surgery: choosing the best implants for your eyes. The implant you pick will determine how well you see for the rest of your life, so it is a big decision. If you're feeling overwhelmed by the countless implant options out there, this video is here to make it easier for you to design your vision for the rest of your life. Alright, let's get started. In order to choose the right implant for your eyes, you need to know the answers to these 3 questions. Number 1, are your eyes healthy? Are you dealing with conditions like macular degeneration, glaucoma, keratoconus, or other eye issues? Some advanced implants, like trifocal implants, are suitable only for healthy eyes without conditions like macular degeneration or glaucoma. Toric implants for astigmatism correction are only suitable for eyes with irregular astigmatism. If you have keratoconus, had prior eye surgeries like radiokeratotomy or corneal scarring, toric implants might not be a good fit for you. In such cases, monofocal single vision implants could be your best bet. Plus, there's a new player in town, the Cataract implant, designed for people with irregular corneas. I will explore this in a future video, so stay tuned. And if you haven't already, make sure to hit that subscribe button and turn on the notification bell so you won't miss any of my future videos on eye health and eye surgery. Number 2, how active are you? And do you want freedom from reading glasses? If you live an active lifestyle and prefer not to be tied down to reading glasses, advanced presbyopia correcting implants are probably the way to go. We're talking trifocal or extended depth of focus, also called EDOF implants. Toric single vision implants or basic monofocal implants won't give you the full range of vision, including distance vision for driving or watching TV, intermediate vision for computer work or reading car dashboards, and near vision for texts on a cell phone or small prints in a book. If your eyes are healthy, and your eyes are most likely capable of seeing full range of vision without glasses with the right implant. You have got 2 options here. The first one is to go for trifocal implants like Panoptix or Synergy. This can be placed in both of your eyes, ensuring that you enjoy a full range of vision in each eye, and this option gives you better reading vision. The second choice is to opt for an EDOF implant such as Vivity, Symphony, or a light adjustable implant in either eye. With this setup, one of your eyes is set for clear distance vision, while your other eye, typically the less dominant one, will be set more for close-up near vision with slightly blurrier distance vision to help achieve close to the full range of vision when both eyes are open. This combo is known as mini monovision design. This option will give you good distance vision and intermediate vision, but you may still need reading glasses sometimes. Number 3, how much night driving do you do? With advanced presbyopia or near vision correcting implants like trifocals or EDOF, there's a slightly higher risk of experiencing positive dysphotopsia. Those are unwanted visual phenomena that can be bothersome. This might include glares, light streaks, starbursts, rings, or halos around a light source, which can persist in roughly 0.2 to 3% of patients 1 year after cataract surgery. So if you're a professional driver who often operates at night, or you're highly sensitive to nighttime halos or glares, trifocal or regular EDOF implants might not be the best fit for you. You should consider toric single vision implants for astigmatism correction and distance vision correction. Your specific needs might also depend on your profession. For instance, if you're a painter or photographer, you may prioritize color contrast, making light adjustable implants more suitable. If rapid vision recovery is your goal, trifocal or regular EDOF implants might be a better option for your eyes than light adjustable implants, as the latter require multiple visits after surgery to lock in the final implant shape. Remember, there's no one-size-fits-all solution when it comes to implants. There's no single perfect implant for every eye. Choosing the right implant for your eyes ultimately depends on the health of your eyes, your vision needs, and your individual preferences. It is essential to have a thorough consultation with your eye surgeon so you can achieve your best vision. If you want to learn more about this topic, you can watch these 2 videos about how to choose the best implant for your eyes and what to expect for your cataract surgery. If you would like to schedule a consultation with me, you can contact my office to schedule an appointment. I hope you find this video helpful. If you have learned something new today, don't forget to hit the like button and subscribe to my channel. Your subscription helps me continue to share valuable videos about eye health and surgery with the world. If you're short on time, you can watch short fun videos about eye care tips on Instagram at Dr. Audrey Tai. You can also follow me on Facebook and LinkedIn at Dr. Audrey Tai to learn more about my practice. I look forward to connecting with you there. Thank you again for watching, and I will see you in my next video.